So having well water is absolutely just vital because city water or town water does not come out to my neck of the woods. Well, I've been in this home for 22, almost 23 years. It's just been a place, it's a family home, have loved it. It's just been a beautiful place to call home. We had to exit the home pretty quickly because of how quickly the water came in. You know, there's been so much destruction, so much damage to the actual home itself, but it was just really vital to me whenever all the public service announcements were going out, you know, that we needed to get our water tested and do not drink it and all those things so that you could begin your cleanup or at least have some clean drinking water.
Once the cleanup effort began, we started thinking about how can we help get out and help the community. We need to, get in the field and start helping people disinfect their water supplies. We knew we were going to have to help some people. We wanted to be able to hand these kits out so people could do it themselves because we knew we didn't have the manpower to get to everyone that we needed to.
DHHS was a huge help throughout the whole process. They were there to support us. They worked as quickly as possible to help get supplies for these well disinfection buckets, to provide those to us, help to provide guidance as soon as possible. We were able to get some of this information out on airwaves, and we worked a lot with our first responders to provide some of our informational documents to different locations throughout the community. Most of the people in our 3 counties are on private wells. That's their only source of water, and so it's really critical to their health to be able to have that safe drinking water.
Well, I'll tell you what, going over to the faucet the very first time, and being able to collect your own cup of water, because I had been, for 23 weeks, I was actually in temporary housing. It tasted like the water that I knew, and I didn't have to be worried about, any kind of contaminant being in it. They reached into my life. They reached into where I was at. They made sure that there were ads, whether it was on the radio or whether it was like, just signs beside the road or wherever. But they were reaching out to me to make sure that I knew that there were resources available.
NC Public Health. Everywhere, every day, everyone.